Hi, this cute little fella here is called Alfie, and obviously he's a rabbit, and he's a very, very young rabbit, and I want to talk about a problem that he has that we commonly see with rabbits, only in him it's much, much worse. So the two most common problems that we see in rabbits are dental disease, and that's why Alfie's here today, and also gut upsets. So I'll quickly mention gut upsets, gastrointestinal upsets, as a quick sort of learning tool for you guys. So rabbits living out there a million years ago and even living out there now eat lots and lots and lots of really bad, dry, hay, coarse type pasture. So in other words, they're just eating rubbish, if that makes sense. And that's what they're designed to do. Their gut is designed to be churning over all the time and eating or digesting really poor quality pasture. So when we bring them into our homes, we typically make their meals much better in inverted commas. Now, the much better meals in inverted commas typically consist of pellets and those sorts of foods. Very, very, very inappropriate, totally the antithesis of what they would normally eat. So if you've got a rabbit at home, you should be feeding things like alfalfa hay. You should be feeding things like bok choy, spinach, those sorts of things, and have a really a lot of dry meadow hay and whatnot with them as well. The pellets should be left as an occasional treat, and that's it. And that type of diet will go a long way to minimising gut upsets, tummy upsets in these guys. Now, what Alfie's here for are teeth. Now, rabbits in the wild are digging and burrowing all the time, and so they use their sharp little nails to burrow, and they use their teeth. Now, obviously, if you're digging in the ground all the time, the teeth will wear out. And these guys are interesting because their teeth are never ending. As the teeth are being worn down here, they're growing up in the cheek. So their teeth are constantly being worn away and being regrown, worn away and regrown, worn away and regrown. Now, if the teeth aren't worn away, they will continue to grow. And they'll actually, if they're not meeting perfectly, they'll overlap each other. So if you've got a rabbit, make sure that your rabbit has got plenty of things to chew on in the hutch or wherever you have him or her, so that it's wearing the teeth away. Go and find some old wood. I typically like those door chocks, the triangular door chocks that are made of pine or some other rubbishy type wood, and just find a wood that your rabbit likes to eat. Dowel, the other thing is curtain rail, curtain dowel. I like that as well. Just find a size and a shape and a type of timber that your rabbit likes to eat, and that will go a long way to helping prevent dental disease. Now, we've done all that with Alfie, and it's not working. So Alfie's teeth are overgrown really, really, really a lot. Now, he's very wiggly. I don't know if you can focus in on this, Felicity. But you can see how overgrown his teeth are. Look at incredible amount of overgrowth there. Now, his teeth were trimmed 2 weeks ago. So if you have a look at that big spike that's growing up there, and that's grown in 2 weeks. Now, we're a second opinion on this guy, and up to now he's just been trimmed regularly, but he's got to be trimmed every 2 weeks. He's 6 months old. It's going to be virtually impossible to trim him every 2 weeks for the rest of his life. So we're doing Alfie a huge favour, and we're going to take those 4 incisors out. And I've mentioned this on a video before. We've got a very special instrument called a periotome, and I'll show you how we use it, and that will take those teeth out, and then Alfie's teeth problems will be resolved. Now, just before I go, one thing, if you are trimming your rabbit's teeth yourself, if your rabbit needs tooth trimming, you need to be really, really, really careful. I know a lot of people will use scissors or pliers, side cutters, and all sorts of things to trim their teeth. What that does is it'll cause a fracture, a long fracture up the tooth, the length of the tooth, and that will expose the nerve. So it's like you or me having a broken tooth. So it's very, very inappropriate to just get a pair of pliers or side cutters or anything else like that and trim your rabbit's teeth. So please don't do it. what we do here is we have the same sort of cutting burr that your dentist uses to do bits and pieces on your teeth. We have one of those. They're water cooled, and your vet, if you're not one of our clients, will have one of those as well. So go in or come in here and we'll trim them regularly for you and do it properly. Please don't do it yourself with one of those side cutters. You will cause incredible pain to these guys. Alrighty, I'll see you in the surgery. So here we have Alfie under anaesthetic. He's nice and snug and warm. One of the biggest problems with these guys is heat loss. So he's on a heat mat, and also this is a heating blanket. I just want to show you that we've already started a little bit of work on his teeth. I just want to show you what his teeth look like. We're going to put an endotracheal tube in a sec, but you can see how those teeth are overlapping. I've already started to just have a fiddle around. One of the sort of surgery is there's a lot of blood when we remove teeth. Anyway, we better get cracking because I don't want Alfie to be on anaesthetic a second longer than he has to. I'll show you what some of the things as we go through the show. So that's one tooth that's been removed. So you can see how long the tooth is compared to Alfie's mouth. So it's a huge tooth compared to the size of his mouth and compared to Alfie. We've got this magic piece of equipment called a periotome, this thing right here, and this blade goes all the way up and around the tooth. We used to have really struggled to get rabbit's teeth out in the past. This has made the process so quick and easy. Yes, there's still a lot of blood, but we do the surgery now in a quarter of the time and much less pain for these guys, and the results are wonderful. So I've got to get back to it. I'll let you see the end results when we're back. Alrighty, we're back with Alfie. First of all, there's the teeth, there's the blade of the periotome that we used to remove it. These little shards here are just some supernumerary teeth, some extra teeth. He had 2 of those. There's a second one that's in here somewhere. It's just so small you can't see it. There it is. And then we'll just take his mask off. He's just being oxygenated while he's recovering at the moment. And you can see that it's very bloody, so if you don't like blood, look away. But all his front teeth are gone. Those holes are designed to drain because there's so much blood that'll come out. So he will be going home on some pain relief, and he will have no more issues with overgrown teeth. So hope you learned something interesting today. Main thing with bunnies, remember, teeth disease and gastrointestinal disease. See you in the next video.